Hi, this is Mayor Maureen Miller Brosnan, and I want to take a minute to thank you for your vigilance in adhering to Michigan's Stay Home, Stay Safe order. I know this hasn't been easy, but we're hopeful that it's going to begin to pay off. Today, I wanted to take a moment to talk to you about one of the reasons why Livonia may be slower to rebound from the COVID-19 pandemic than other cities. Livonia has nearly twice as many COVID-19 cases per capita than the statewide average. We rank second in the state in the number of COVID deaths behind Detroit. 16.6% of our residents who have gotten COVID-19 have died from it. And that's more than any other city in the county and most likely the state. And it's even a higher rate than New York City. So why is this? It's because of the large number of long-term care facilities we have in our city. Livonia is home to 22% of all the long-term care centers in Wayne County. So, while the county and the state resources continue to be limited, Livonia has stepped in with an aggressive plan to help the 15 nursing homes and the 13 senior living centers caring for close to 2,100 vulnerable lives. The program, called Together Livonia Cares, has been successful in reaching all of these organizations over the past 2 weeks, bringing them needed supplies and training and expertise. But there's still more work to do. Last week, 38 communities, including Livonia, received our first round of funding from the CARES Act, and that's the federal relief plan designed to compensate communities for money that we've lost or increased costs that have been caused by the COVID pandemic. This money is designed to help us help nursing homes and senior centers drive down the number of COVID cases and COVID deaths in our city. The 10 largest cities in the state received checks averaging at least $360,000, except Livonia, which only received $196,000. Of the 38 Michigan cities and townships which received money from the CARES Act, Livonia ranked 33rd in dollars allocated. Livonia is receiving the least amount of funding among the 9 Wayne County municipalities receiving these funds. And to make matters worse, in a clear example of a formula that's not meeting the need, Livonia has 1,200 fewer people than Dearborn. But we have 35 more COVID cases and 24 more COVID fatalities than Dearborn. Yet, Dearborn received over $1 million in funding compared to Livonia's $196,000. The bottom line is, the formula used to calculate how money is allocated to cities is failing one of the cities that's most impacted by COVID-19, costing us lives and a swift return to economic health. This week, we're going to be focused on talking with our legislators in Washington, D.C. about how to change that. So let's talk for a minute about our city's financial health. While it's impossible to know what the ultimate financial impact of COVID-19 is going to be, here's what we know so far. State shared revenues for March and April are projected to be only 50% of normal due to lower sales taxes collected by the state. This is a $1.4 million reduction to city revenue. Lost fees for the rec center and rec programs will result in a projected $1.5 to $2 million loss. Recreation, inspection, and the library are 3 of the hardest hit departments in the city. Livonia has a large business sector, including many hotels that have been inactive since the shutdown. So we expect a 15 to 20% reduction in revenue from water sales. People are driving much less and using much less fuel, and this directly impacts the revenue that we get from gas taxes to maintain our roads. Property taxes could suffer due to increased unemployment, reduced real estate values, and slower housing market. So, while many cities are waiting to see how this all sorts itself out, know that Livonia is working to solve this problem now. We've reduced the city workforce by 37%, resulting in payroll savings of $160,000 per week. We've undertaken a capital cost containment program that's designed to either defer, eliminate, or scale back many of the projects in the capital outlay programs that we had on the docket this year. And we'll be fighting hard for our fair share of the CARES Act funds. Like I said, this is not easy. But part of how we're going to make it through this crisis is a clear understanding of what we're up against. And that's the goal of these conversations. So stay home, stay safe. Right now, the virus is running our agenda. We need to contain it so that we can get back on with bringing our economy back. Thank you.